audience.
All right, we're going to talk about what we call Coffee and Snuffy. That's what the kids named them, cough assist and suction device. The biggest problem, one of the biggest problems with an ALS patient is the mucus they get. And it gets stuck in their throat and they can't swallow it. It's thick enough they can't swallow it, and it's thick enough they can't cough it up. They've lost their ability. So it just sits there and they choke. And they can basically choke to death on it. Although apparently there aren't a lot of people who actually choke to death on the mucus, but it certainly panics them. So we have the cough assist, and we'd use the cough assist on Christy. It has a on button, and then it has a standby. You want to put it on therapy, and so it's going to now start to suck and blow. I think it blows first, and then it sucks, and the respiratory therapist can give you different angles on it. Go ahead and put it on. I want to see how it does. This may be a mistake, but we're going to see. Christy, it was a lifesaver for her, and she'd cough a lot up into her mouth and would immediately get the suction device. By the way, this is the same cord air hose that the Trilogy uses. You ready? I guess. And it sucks the mucus out, gets it up in the throat where you can get it with the suction device. And as I remember, you weren't there, but we had to practice with the cough assist when we first started. And it takes a rhythm, quite a rhythm, and I just figured that out. I never tried it before, but Christy liked it a lot. Well, it was a lifesaver for her. And she'd cough it up, would immediately go down with the suction device. It has a vacuum in it. It draws a vacuum in this container, and then the vacuum sucks through the tube, so anything that's in the way it sucks out. And she kind of ate stuff until the end. She just went to sleep and died yesterday. It was kind of nice, actually, but we'd feed her corn and stuff, and she'd choke on it, and we'd go down and it'd pull the piece of corn or the piece of meat or whatever it is back out of it. Go ahead and turn it on. I'm not sure I want to try this. She didn't gag, amazingly. It'd go down. Cameraman say, no, don't do this. She wouldn't choke on it because she was already choking on the mucus, but it'd suck out whatever was in her throat, and we'd put it down to where it was pretty much up to about there, so it went down that far. We'd go down, keep it on the back of the tongue so that it's actually touching the back of the tongue and the throat, and then when you get down, you can hear it, it'll suck, and it'll start to pull stuff up, and then we'd turn it and bring it up the side and out. We'd put it down again, turn it, and bring it up the other side and out. And we'd have to do that twice sometimes. It wasn't unusual to do one down, up one side, one down, back up the other side, and then one more back up one or the other sides. When we didn't do the cough assist, she'd be lying in bed and she'd just say, we got to have Snuffy. So we'd get Snuffy and we'd go down after the mucus. Lee Phillips talking on suction devices and cough assists.